Welcome to SBIRT Module 1, Part 2, Screening. I'm Dr. Dana Brackney, an RN and nursing researcher at Appalachian State University. The goal of this session is to provide the participant, including those from medical, healthcare, mental health, school health, and allied health professionals, with the information, tools, skills, and resources to successfully screen people and those in their care. Participants will learn how this is done within their school or practice setting and will be oriented to the use of brief and valid substance use screening tools. Our learning objectives for this session are to understand the rationale for universal screening, identify potential health impact of substance misuse and abuse, identify substance use risk limits, identify how screening is conducted in a practice setting, including pre-screening and screening, learn how to use the audit, DAST, CRAFT, and anxiety depression assessment tools, understand how to score and use the screening assessments with a brief intervention. So why is universal screening important? Do you see any potential problems or challenges with universal screening? Usually negatives include patients won't like it. I'll feel uncomfortable. It will take me too long. What do I do when I find a problem? All are important discussion points addressed in this series. An integral part of SBIRT is universal screening. Drinking and drug use are far more common than we think. Drinking and drug use increase the risk of health problems and create safety risks and a host of social and legal consequences. Integrating screening as a universal process normalizes the relationship between a clinician and their patient conversations regarding substance use because we screen everyone. Drinking and drug use often go undetected. Persons who appear to be like us could be at elevated risk. If we don't ask, we don't know. Studies have demonstrated that people are far more open to change than we might expect, particularly those persons at risky levels of use who've not quite escalated to a level of dependent use. Universal screening detects health problems related to at-risk alcohol use and substance use at an early stage. This is important before it results in a more serious disease or health consequence. Detecting alcohol and substance use patterns can help prevent future injury or illnesses. Screening serves to intervene and educate about at-risk alcohol and other substance use, its risks and consequences. Screening can be a significant step to effective intervention, and if we don't ask, we don't know. The clinician or student services is often the first point of contact. Early identification and intervention lead to better outcomes. Patients or students are often seen by a clinician or a student services provider because of a related physical or other emotional problem. And I just want to note throughout this, we use several terms: person, patient, student, because there are many settings in which these screenings are conducted. At-risk substance use can be effectively managed and addressed if the presence and pattern of use is identified. One of the largest obstacles to effective screening and intervention is the failure to administer a validated substance use screen that guides the appropriate level of intervention. From prevention messages for non-users to offering brief advice for those without a substance use disorder, and counseling and treatment. In this module, you'll learn how to introduce the topic of substance use and what questions to ask. In subsequent modules, you will also learn about brief, solution-focused, motivational counseling called brief intervention, which provides the framework and strategies for helping adolescents and young adults choose and act to reduce risks associated with substance use. Several validated screening and assessment tools are available for discussing with adolescents and young adults about substance use and mental health. In this module, we highlight validated tools that are most common for screening, brief intervention, and referral to treatment, which we call SBIRT. According to the Joint Commission, a validated screening questionnaire is an instrument that has been psychometrically tested for reliability. And reliability is the ability of an instrument to produce consistent results. They're also tested for validity. Validity is the ability of the instrument to produce true results. And sensitivity. Sensitivity is the probability of correctly identifying a person with the condition and not identifying people without the condition as having it. Validated tools maximize the effectiveness of screening, provide a level of care determination, and remove errors that result from sole reliance on clinical judgment. This module covers substance use screening tools that assess risk related to alcohol, tobacco and nicotine, marijuana, and other substance use, including non-medical use of prescription medications such as opioids or perhaps even Adderall. Some tools screen for only one substance, and other tools simultaneously screen for multiple substances. Those shown here are covered in this module, along with example role plays and sample dialogue that can be used to learn how to effectively screen. This module briefly covers validated mental health screening tools that assess anxiety, depression, and suicide risk, which often co-occur with substance use. Give you a moment to look over those. There are many. Based on reviews of adults screened using the audit or DAST, 4 levels of risk based on screening scores have been determined: low risk, at risk, harmful use or high risk, and it's presumed dependent use. Scoring and interpreting is discussed later in this presentation, but these are the categories of risk which we discuss. The National Institute of Alcohol Abuse and Alcoholism's approach is not the only approach to assessing risk. The developers of the craft identified 3 general patterns of substance use risk based on using the screening tool that's described in further detail later in this module. Low risk are adolescents who report no use of substances in the past 12 months and report that they have not ridden in a car with a driver who has been using any substances. That's a score of 0. Medium risk are adolescents who report no use of substances in the past 12 months and reported only that they have ridden in a car with a driver who has been using any substance, or they report use of substances in the past 12 months and have a CRAFT score of 0 to 1. High risk are adolescents who report use of substances in the past 12 months and have a CRAFT score of 2 or more. So there are variations in how risk can be categorized based on the tool that's used. The medical and psychiatric consequences of high-risk drinking are well documented for those drinking at dependent levels and also for those moderate to high risk. Nearly all systems of the body can be adversely affected by risky or dependent levels of use. Session handouts provide detailed information on consequences of substance use. Consider what might be examples of social, mental health, or workplace consequences of substance use, as we will discuss this further later in the workshop. Here are some basic points to consider when you begin the conversation about substance use with any person, whether they're adult or adolescent, anyone. We want to be sure to ask permission to discuss the results of the screening or to discuss the topic. This is especially important, I believe, in adolescents who often are talked down to or put upon by adults in their life. So asking permission sets the spirit of MI, which is collaboration, and it sets off the discussion right away as being collaborative. Screenings can be verbal, written, or electronic. So often it's good to have the screening done in a separate space from the encounter where you might ask permission to discuss the results of the screening. Consider including it with other health assessment tools so it's not a one thing only. For example, if someone injured themselves, you would include the assessment of their pain level along with the assessment of their substance use. And start with the pre-screening questions to determine the need for the full screening. So when screening, it's useful to clarify what one drink is. Unlike other substances that have no recommended safe levels of consumption, level of risk associated with alcohol use is assessed in part by understanding exactly how to measure one drink. I will say there's been new evidence showing that no level of alcohol consumption is beneficial. And this has been a recent finding. So do keep that in the back of your mind as you discuss this. This would be a major shift in our culture to consider all alcohol use as harmful. It may seem obvious what the adolescent's answer means to the question, how many drinks containing alcohol do you have on a typical day of drinking? But the definition of a drink can be subjective if a definition is not provided to the adolescent. Having a standardized measure of drinks will help you to understand the risk to which the adolescent may be exposed. In the US, a standard drink is any drink that contains about 0.6 fluid ounces or 14 grams of pure alcohol. Although the drinks pictured in this figure are different sizes, each contains approximately the same amount of alcohol and counts as a single standard drink. This chart can be made into a pocket card or used or displayed as a visual aid when conducting screening. I would say it would be good also just to have various glasses and sizes so that students could touch or handle that to understand what that also looks like. A copy of this chart can be found in Appendix B of the Learner's Guide. A single can or glass of alcohol can be 1, 2, or many drinks. This figure identifies the number of standard drinks in many typical containers of alcohol. It can be difficult to estimate the number of standard drinks in a mixed drink. A mixed drink can contain 1 to 3 standard drinks. The National Institute of Alcohol Abuse and Alcoholism offers print materials and resources that help estimate the amount of alcohol content, calories, and cost of one drink. Adolescents may consume alcohol from these and other types of containers. For example, they might split a large bottle, like a fifth or a handle of alcohol, or a large can of beer. So knowing how many people shared the container can help estimate the amount consumed. Similarly, alcohol is often concealed in water. So estimating, or in water bottles, so estimating the percent consumed could help determine the number of standard drinks consumed. And in addition, the popularity of like seltzer, hard seltzers and other things simply complicate the exposure that young people have to alcohol. Expert interventions work best when you embed your screening process into your routine workflow, just part of what you normally do, like you would take someone's height or their blood pressure or ask about their pain. So this slide shows a workflow for basically a medical practice, but you could apply this process to whatever setting you are in. The idea that you first have the person who is going to be seen, and then they are given a screening. If it's negative, that's the pre-screen. Then there's nothing more done. If it's positive, more other activities take place. So just be thinking about this as far as your implementation, that we really need to have a workflow for embedding SBIRT into your practice. This includes wellness screens, because remember, we're screening everyone. We're not identifying people as at risk and doing those folks, although we'll do those too, of course. But it's important to remember this is part of a wellness check. When people take a person to an exam room, for example, they can quickly review the wellness screen. And so just set in place the actions that you want to take in your particular setting. The screening strategies are brief, but they've been validated. The questions recommended for use are the single question screener or the Audit C and the accompanying NIDA single question drug screen. So these questions are the important ones to start with. On average, in primary care settings, 20 to 25% of individuals screen positive. Other settings such as HIV/AIDS counseling, testing sites, or mental health clinics often have higher rates of positive screens. So this concludes the overview section on screening. Next, you will move to the audit. Thank you for your attention to this, and we will have additional materials and opportunities to practice with these in the workshop coming up.